Have you or a loved one been told your pain is due to spine degeneration and wondering what to do? Do you feel like you just have to live with it and that's what you've been told to do? Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing pain from degenerative discs and degenerative joints for decades with my patients. Please note, these videos are not a substitute for professional medical or chiropractic advice, for diagnosis, or for treatment. These videos are for informational and educational purposes only. Seeing the wrong doctor can result in an incomplete diagnosis, wrong treatment, and persistent pain with poor recovery or no recovery. So let's discuss what degeneration of the spine is. Simply, degeneration of the spine is where the discs and joints just start to wear down over time. Now, discs are soft shock absorbers between bones that actually connect the bones together. Joints are where two bones meet. They are connected and held in place with ligaments that are called straps, and these joint surfaces are covered with cartilage. Degeneration can develop over time. It can develop due to repetitive use. It can develop due to too much sitting, a sedentary lifestyle. It can develop over time following a traumatic injury where the joints are damaged, or it can just be due to wear and tear. Now, why is it painful? Well, degeneration can result in increased compressive forces across the joints and the bones. The joints can start to rub against each other, and the spinal discs can thin out and dry out. This can lead to a cycle of pain, spasm, inflammation following activity, and then further wear and tear. Now, not all degenerative conditions are painful, but the risk of pain increases the more degeneration a person has. Patients suffering with symptomatic degenerative discs and joints that we see here at Twin Cities Headache, Neck, and Back often describe some of the following symptoms. They start having progressive increase in stiffness, a gradual loss of range of motion in that region, and then pain during activity or sometimes pain following activity. The types of degeneration that can show up are thinning and dehydration, and this is oftentimes most common. It's called degenerative disc disease. And as the joints themselves start to wear and tear, the surfaces become rough, and this can be seen even in larger joints. This is called degenerative joint disease. As the tissues wear out, extra bony deposits can build up, and this is called spondylosis. If the bony deposits accumulate in the spinal canals, a condition called stenosis can occur. Sometimes the bones build up where the nerves exit out of the spine, and this is called foraminal stenosis. The foramen is where the nerves exit out of the bone. Now, to diagnose degeneration of the discs or joints requires a detailed history, a physical exam, and actually you end up needing imaging to confirm the location and severity of the tissue changes. This imaging can either be an X-ray, MRI, or CT scan. Based on location and severity of the degenerative changes, treatment planning may need to be modified and recovery expectations might need to change. Pain relief is the first thing that patients are interested in, and we offer some non-surgical treatment to relieve back and neck pain caused by degeneration of the discs or joints. Common treatment that we do here is chiropractic adjusting. Now, that's typically flexion distraction adjusting. We can also do manual therapy. We can do acupuncture. We can do dry needling, traction. Rehabilitation with stretches and exercises once moving better and less pain are oftentimes implemented. Now, spinal adjusting, especially the flexion distraction adjusting, this relieves the pressure in the discs and in the joints. It also opens up areas where there is stenosis and can decompress nerve tissue. Some patients unfortunately require medical care in conjunction with chiropractic care in order to speed up the pain recovery and maximize recovery. Chiropractic care at our clinic is gentle and effective. Now, in addition to reducing pain, the next goal is we need to improve your function. The goal is not really to reduce the degenerative changes. The goal is to reduce the pain levels and improve your ability to do day-to-day activities such as exercise with the least amount of pain possible and, of course, hopefully no pain. Long-term, what can you expect? Well, for a long time, we've known that chiropractic care can help. Back in 2009, Consumer Reports looked at over 1,000 subscribers who rated their treatment of choice for low back pain. 88% of those who tried chiropractic adjustments reported positive outcome. And this satisfaction resulted in a highly satisfied category where the chiropractors were placed. So when should you see a chiropractor if you have degeneration? Well, if you or someone you know is suffering from degeneration and you're not under chiropractic care, get examined right away. This does not get better on its own over time. Here at Twin Cities Headache, Neck, and Back, we're here to help you. Call us today at 651-925-5530 to schedule an examination. In closing, thank you for taking time to listen to this video. You have many voices to pick from, and I'm honored that you chose mine. It is my hope that this information helps you with your decision making. I wish you all the best, and until next time, be blessed.